Assalamualaikum warahmatullahi wabarakatuh, and good day everyone. Today I'm going to share with you what is GAIT analysis is all about. I am Noritawati from College of Engineering, University Technology Mara, Shah Alam, Selangor. Okay, so as an introduction, I'm going to share with you the definition of GAIT, the potential application of GAIT analysis at present, and where can actually we explore GAIT analysis in our future research. So what is actually GAIT? GAIT is actually the manner of walking. So a GAIT cycle consists of 2 steps or 1 stride where the activities that occur from the point of initial contact of one lower extremity to the point at which the same extremity contacts the ground again. So during one GAIT cycle, each extremity passes through 2 phases, a single stun phase and a single swing phase. So highly controlled, coordinated and active series of limb movement whose function is to advance from one place to another with minimum expenditure of energy. So GAIT is the medical term used to describe human locomotion or the way that we walk. Therefore, it is a locomotion achieved through the movement of limbs. So different GAIT patterns are characterized by differences in limb movement patterns. Hence, every individual has a unique GAIT pattern, while there are some features in a person's GAIT that are common for everyone. So let's see what is a GAIT cycle is all about. So one GAIT cycle is defined as the movement of a single limb from heel strike, which is the initial contact, to the next heel strike. So these are subdivisions of GAIT cycle where I'm going to define in a very layman term what is each of this term is all about, because these are the features that actually we extracted when we conduct GAIT analysis. So the walking process, the first one will be a GAIT cycle consists of 2 steps, as what I have actually mentioned earlier. So the stun phase comprises of 60% of the GAIT cycle, while the heel strike is actually when the moment the first strike hits the ground. As for the foot flat, it is actually from the heel strike to where the full foot is in contact with the ground. As for the mid stand is when the body weight is at the stance of our leg. So as for heel off is when the moment the heel of the stand leg leaves the ground, and toe off is when only the toe of the stance leg is in contact with the ground. Next is actually the swing phase, which comprises of 40% of the GAIT cycle. Just now we have shared that 60% is the stance. So acceleration is when the toe of the stand leg leaves the ground and begins to swing forward. And mid-swing is when the swinging leg is directly beneath our body. And deceleration is the swinging leg continues forward towards knee extension, but is slowing down as we travel, stopping just prior to full and knee extension, and heel comes to the ground. Okay. So these are examples of GAIT applications at the moment that comprise from medical, security and sports performance. So let's see what is GAIT deviation is all about. And what causes GAIT deviation? One is because of pain, a weak muscle, maybe abnormal muscle activity, abnormalities in our joints, or contractures around joints, and limb length, the length of our limb, there's discrepancies. So lower walking speeds, shorter step and stride length, these are some examples of GAIT deviations. The rest include reduced plantar flexor force production, reduced the hip extension, reduce our pelvic girdle and hip rotation, increased double support time, greater variation is stride width, as well as wider base of support. That is some examples of GAIT deviation. So what actually affects this GAIT? First is age. Because when we get older, of course our GAIT will differ a bit. Second is maybe because of our height, or Some other reason will be the size and shape of our bone components, the weaken of our muscle is no longer, the muscle strength is weakened, or maybe carrying of bulky load or physical injury. Yeah, that's some of the factors that affect our gait. So in clinical gait analysis, what is actually being done is the study is to actually analyze and study the human movement. Yeah, so what is actually gait analysis? It's all about when it comes to clinical gait analysis. It involves monitoring, rehabilitation, and followed by diagnosing by the medical expertise. Okay, so what actually clinical gait analysis conducted is it assess the degree and extent of departure from the norm, and how does that changes due to the based on the therapeutic intervention, and how does it contributed to improvement based on the rehabilitation results. Yeah, so gait analysis can actually be described as a systematic description and assessment of qualities that characterize human locomotion. Mainly, it is used in pre-operative planning and documentation of post-operative outcome in patients with, for example, autism, Parkinson's disease due to accident, elderly, injury, and also sports performance. These are some examples of gait analysis research that is conducted around us. Okay, so these are some of the clinical methods of gait analysis that is being utilized at the moment. Some popular one, which based on the ground reaction force, which is the pressure on bottom of feet. For example, on the left hand side, you can see how we can see a flat, normal, and high image, yeah, due to the pressure distribution of our foot. Yeah, and on the right hand side is actually based on the laboratory experimental on the polygon, and the 3D dimensional based on kinematic and kinetic analysis. Okay, so it can be a combination of kinematic and kinetic as well. So another example of gait is gait as biometric, yeah, which involve data acquisition, data preprocessing, feature extraction, and gait classification. This is actually on how it is similar to other biometrics techniques, for example, retinal, voice recognition, and fingerprints, with the purpose to identify individuals. So gait as biometric is a method of identifying individuals by the way they walk. Okay, so how it is being done, actually what is being measured is how the foot hits and leaves the ground during walking using the 3D image processing technique. And we conduct the feature extractions to allow subjects during walking and analyze their heel strike, roll to forefoot, and push off by the toes. Like what I have mentioned earlier, the features during stance and swing phase. Okay. So the next one that I'm going to share is about gait analysis in sports performance. We actually can measure the center of pressure during running and also during walking, and the difference between there, actually we can actually measure, okay, how the performance of the athletic is enhanced or vice versa. So those are some examples that I have shared with you for potential research in gait analysis. With that, thank you.